This track is especially for preparation for embryo transfer. You can use this in the weeks or months or even days ahead of embryo transfer. And then once you've had a chance to listen to it a few times and practice it, you can then listen to the Embryo Transfer Practice Track. The theory behind this is that when they actually introduce the very small catheter up through the speculum into the uterus for transfer, it can cause some tiny reactive spasms in the uterus. And these little contractions can go on for hours or even a couple of days. And the idea is that potentially that could impact how well your embryo is able to settle and implant into the area. Learning how to relax the smooth muscle of the endometrium is something that will improve your experience. It will make it easier for the physician who is doing the transfer, and it may also improve the chances of implantation. There was a study done many years ago that showed that using a technique similar to this would improve the chances of implantation up to 50%. So all you have to do is listen to this teaching track that will talk you through the process of how to engage and focus deeply on your body so that you can work with these muscles, and ultimately you will be able to turn everything off into a nice, calm, relaxed place at any point, at any time. You don't need to be particularly focused and relaxed in the moment to do it. You'll be able to do it automatically even if you're talking or doing something else. So once you've had a chance to listen to this track a few times, you can then go on and listen to the Embryo Transfer Practice Track. So let's get started. Find yourself somewhere comfortable to be and allow the surface on which you're resting to support all of your weight. Let your eyes close and just settle in and settle back. Take as long as you need to get ready, to relax down, to shuffle and adjust. Whatever you need is absolutely fine. And there is no particular way or headspace that you need to be in order to benefit from this. This is you learning how to be an ally with your body, to work together towards the outcomes that you want, that you deserve, and that are absolutely reasonable and achievable. So let's focus first of all on the hands and the wrists and the fingers. I like to start here because it's a really easy way to show your body how to relax down, how to stop holding yourself up quite so much, so that we can start to take some of the focus away from the outer edges of the body and go deeper inside. All the time you're going to be just as lucid and focused as you want to be, totally present and in control. It's just that the calm will come in and you'll have that focus that's just about you and this process. So start to get some softness and offer some relaxation through your fingers, your hands, and your wrists. See if you can let them go as dead weight as you can. Every breath in, you're just welcoming in the calm, the space that you're giving yourself, the dedication to this process. And every breath out is an opportunity to relax down a bit more. And allow that wave to continue through the rest of your body, wherever your attention is drawn. Might be your head, your back, your shoulders. There's no particular order, no time limit. Just letting those outer edges soften into the background. And in the meantime, your mind might wander, and that's absolutely fine. Whatever you need, you'll get from this. And when your mind is ready, it will focus more deeply and be right where you need it to be. So we're going to now just continue to let that softness come over the legs and the arms and the head, the back. And in the meantime, begin to imagine or visualize, or just be aware of the concept that there is this link from the mind that goes all the way down through the center of the body, right down to the uterus. And that there are hundreds of thousands of networks spanning from this core, like a network of golden threads that goes all across the uterus, across this smooth muscle and the ligaments, this whole structure and the surrounding muscles, the pelvic floor, the vaginal wall. Just focus the breath in this area and imagine, or just accept the concept of that network that's going on all the time. This is a network of the communication that goes between the brain and the uterus around sensation and muscle movement. So the blood flow, that will continue all of the time. What we're going to work on are the actual feelings, the sensations, and the muscle movement. So every time you breathe in, we offer light. Everything can light up, bringing in the warmth, the nutrients, the love, the calm, anything that you could want, anything that you want to offer this area in your body that you're preparing. And I'm going to start to count down from 10 to 1. Nothing particular needs to happen. This is just an invitation for you to focus more deeply on your body and on the sensations so that you can have complete control. And as I count down from 10 to 1, when I get to 1, I'm going to start moving a bit more deeply into the body, into those sensations, into those connections. 10, 9, 8, just letting the outer edges of the body continue to soften. Let your hands get so heavy that they just can't be bothered to move. All your focus coming inwards. 7, 6, 5, 4, 3, 2, 1. You are in control of your muscles. This is your brain and your body. And as we introduce all this calm with the breath coming in, what we can also do is ask all of the connections that allow movement, that allow sensation in that whole area of the lower abdomen to go completely quiet and still and off. So in a moment, I'm going to count down from 5 to 1. And what we're going to do is, when I get to 1, every breath in from then on is introducing this calm, peaceful wave. And every breath out, as you hear the word off, there will be this wave of relaxation and calm. And all of those signals that tell that smooth muscle to move or react will go completely still, totally relaxed. All the way down through the pelvic floor, you relax every muscle that you can. And 5, 4, 3, 2, 1, off. Every breath out, bringing in this off. Letting everything go still and calm and relaxed. So it's so easy Everything is smooth, everything is comfortable, and the sensation is drifting away. But you're very aware and very in control. Breathing in the calm, breathing out off and off and off. And it might be that you just feel that it's warm or that you're very relaxed. You might actually feel like there's this wave of complete off, calm stillness. Just like there is in your hands at the moment. So if you wanted to, you could move your fingers, but actually you just can't be bothered. And they feel very settled, almost glued down. And this is what you're introducing to your muscles, this idea that right in this moment you're in control and you're asking everything to go still, off and comfortable, so that it's very straightforward and very smooth for the procedure. And the sensation drifts away and away and away. And everything just remains very calm, and you can imagine or envisage your uterus being very welcoming, very peaceful. And in the moment of transfer, it will be warm and the lining will be thick and sticky. All those lovely nutrients, that rich blood flow. And all the muscle feedback is just for the moment silent and off. And every time you hear the word off, when you say it to yourself in that moment, with your direction, with your consent, everything goes relaxed and calm, no matter what else you're doing. If you think the word off as you breathe out to yourself, that wave of calm will come over your body, wherever you are, whatever you're doing, if that's your intention. And each time that you do this particular meditation, you'll find that you go deeper, that the relaxation is more and more relaxed and focused, that the heaviness and the stillness has more clarity and more calm, greater depth. Breathing out to go off. And just feel those waves of calm as you also begin to just invite the idea of whatever you might want to say to yourself and to your body and to this moment. That you just know that every cell in your body wants this to work. Every cell in your body is wired to find its way to successful implantation, conception. This is what you were designed to do. And you're just having the support to enable your body to do exactly what it wants to do, what it's designed to do, what it's been longing to do. And thank you for giving it this time and these tools. Thank you for giving this offering to your body so that it can do everything that it wants to do, everything that it yearns to do. So in a moment, I'm going to start to ease you back up into a normal, everyday waking state. And what you'll find is that any time that you want to practice this, any time that you just give your concentration to that area of your body and you breathe and you think off, everything will go calm and relaxed and comfortable. Any sensation will drift away. The muscles will stay relaxed and still because you're turning everything off. And being able to work with your body in this way gets easier and easier. And you will already have this programming. So I will count you up from 1 to 10, and you can gradually make your way all the way back into the wakeful, refreshed state, feeling calm, focused, at peace, refreshed, totally in control, and everything will come back just as it was before. All the normal sensation, all the normal movement. 1, 2, 3, easing up 4, 5, gently coming up 6, 7, 8, easing up. Now let's get nice and light. Get your fingers starting to move. 9, getting light around your eyes. 10. So whenever you're ready, you can come all the way back up, refreshed, calm, peaceful, totally connected, working with your body. Everything you're doing is enough. You're doing all the right things. So practice with this track 2 or 3 times if you're able, or more if you'd like to, whether it be the day before, or the month before, or 6 months before. Whenever you feel ready, you can move on to the Embryo Transfer Practice Track. And that way, you can have some support to go in and out of that relaxed state really quickly, really easily, so that you can do it at transfer. No matter what's happening, no matter who's talking to you, you'll be able to work with your body in that way.